The future is here. Digital technologies are reshaping industries all over the world, making physical borders irrelevant in this interconnected digital era. Healthcare is no different, and this highly complex industry is taking its first steps into a digital revolution. Serving one of the largest populations of any health benefits company in the US, Anthem is leading this revolution through new investments and partnerships. By developing cutting-edge hubs around the world and tapping into a growing ecosystem of leading digital innovators, from universities to businesses and across the healthcare spectrum, we're developing next-gen capabilities to apply exponential technologies to not just change the way the world thinks about healthcare, but to revolutionize it to a simpler, more intuitive, personalized, and guided experience for members. Discover the benefits of partnering with Anthem and our ecosystem of leading thinkers. And join us across borders and across the globe in changing the lives of millions through digital technologies. Together, we can create the future of healthcare today. Why? Because digital knows no boundaries.
Hello, everyone. This is Rajeev Ronanki. I'm Anthem's Chief Digital Officer. A pleasure to be with all of you here today. Today, I'm going to cover a number of topics related to health tech. And I want to start this discussion by saying that despite the challenging times that we've all been through and we're still going through, there's reason for optimism and there's reason for a brighter future for all of us. And the reason I say that is because the growth of technology has been faster than ever. And I don't think people realize that how fast things are changing. So if you look at technologies like sensors, there are going to be 1 trillion sensors all around us just in a couple of years from now. Artificial intelligence, blockchain, AR, VR, 3D printing, synthetic biology, nanotechnology, all of these things are growing at an exponential clip and doubling in price performance every 3 months, 6 months, 18 months, very consistent with what, Gordon Moore said, nearly 40 years ago. So any one of these trends on their own, whether it's artificial intelligence or nanotechnology or genomics or synthetic biology, I think would be significant in and of itself. But if you put 2, 3, 4 of them together, I think we're going to be looking at a game-changing, transformative period in human history, leading to perhaps the most innovative time in our entire evolutionary history. The reason I say that is, there's roughly, 5 billion connected lives to the internet today, and within the next 18 months, that number is going to grow to about 8 billion. So think about it. If you have 8 billion people with access to all of that technology, with a lot of capital that's flowing into these innovations, you put it all together, more minds, more money, cheaper computing, access to yet more sophisticated technology. And the nexus of all of that, I think, positions us to be the most innovative, positions us for the most innovative time period ever. And we should all be thankful that we're going to be participating in it. So to do that, though, I think it's no one company can do it. No one individual can do it. It's going to require a collaboration, and it's going to require a platform-based approach. A platform-based approach is one where the people that are participating in it both contribute to the platform and derive a benefit from it. And then the users of that platform, whether they're in the healthcare context, whether they're providers, members, consumers, employers, and others, all need to benefit from it. But more on that later. I want to frame this talk in 2 or 3 sections. First, I want to address, what the current state of healthcare is in the country. Second, I want to lay out, our definition of what a platform strategy and an ecosystem strategy might look like to address some of the issues that we face today. And then look ahead to how this might all change in the months and years to come. So first, let's get into the ills of the system today and some of the problems that we all face. So if you put on the lens of a consumer, I think anything as simple as making an appointment or seeing your doctor and trying to get a summary of the doctor's visit and have that be available for your reference down the road, seemingly simple things to do. are nearly impossible, or only possible if you have a PhD in computer science to make it happen. Healthcare should not be this hard. The healthcare spend is approaching 20% of GDP, and with that amount of spend, something as simple as having access to our own medical information and being able to make appointments and manage that all seamlessly seems to be yet out of reach. So it needs to be addressed, and needs to be addressed quickly, because what we're delivering to our consumers is subpar, and we have all the tools that we need in order to address this problem. So you take that and you multiply that several times over, and I think you get an accurate description of all the issues that we need to fix with the current state of healthcare. Now let's look to what are the techniques, tools, collaborations, and other things that are needed in order to develop a system that's better, and one that puts consumers in the middle of that new system and orchestrates everything around it and makes it really simple for them. For us at Anthem, that starts with having a platform strategy. For us, platforms very specifically mean a computing environment that is able to encapsulate our data and make it available to our community of data scientists and developers to create algorithms, and then make those algorithms available to all of our stakeholders via very personalized experiences. So our stakeholders happen to be consumers of healthcare. They happen to be providers that render care for our patients, employers that design benefit plans for their employees, states that have Medicaid enrollees that have to get care. So how do we design the benefits for them, accounting for all of the things that I just mentioned, and then the rest of the caregiver ecosystem that all needs to come together in order to make this work. So for us, simply the platform that we're creating and that's already live is a place of collaboration for all of these diverse stakeholders to come together on a single unified data platform, which is a foundation for making all of these things happen. And like I said, it starts with the data. Data in healthcare, doubles every 73 days or so. And the Anthem statistics on that are pretty close to what the industry is seeing. However, the industry's problem is that we're not translating much of that data into meaningful insights. And worse yet, we're not making even the insights that are being translated available in a timely manner to the stakeholders that need it. So that's got to get addressed, and it's got to get addressed quickly. So the platform approach that we're taking on is designed to sort of bring together these stakeholders in ways in which hasn't done before, and we're seeing some really good evidence of that. The success of this strategy play out, where wherever we've rolled this out and we've integrated the Anthem caregiver teams, the providers that care for these patients, and our consumers in a meaningful closed loop system, where we systematically take data, turn data into insights into actions, and learn from every action that's working and it's not working. We actually see good results in terms of consumer satisfaction, NPS scores being higher, both for providers as well as our members, and employers really being happy at the end of the day with the quality of care that's being delivered and the cost at which that's being that it's being delivered. So if success is possible in pockets, can it be done at scale? And to do it at scale, we know that Anthem can't do it alone. We need partnerships, we need collaborations, we need the entire system to be working together. And in order to do so, there's some fundamental concepts that I think that need to be true for that to happen. First and foremost, we were talking about healthcare and healthcare data, and which is obviously a sensitive topic for all of us. So I think we've got to start with this notion that consumers own their own healthcare data, and everything that we do with a consumer's healthcare data and their data is up to them to let us do with it, and that's appropriate or not. And every step of the way, I think consumers have to be along for the journey, opting in or opting out, giving us the rights and the consents to use the data appropriately, while being super respectful about the privacy and security that we're all responsible for providing. So if you start with that premise and then you build on it and say, now, any two stakeholders that need to collaborate each have their own sort of privacy and trust ecosystems that they need to manage. But is it possible then to collaborate without necessarily sharing proprietary information? And for that, we've built, some of the foundational layers of our platform with distributed ledger, principles in mind, instantiated on, a blockchain technology. And then what that does is it provides a collaboration platform which allows stakeholders to work together without having to share proprietary information, yet share insights, and then federate those insights across the entire scale of the respective ecosystems of each other's stakeholders group. So that's the strategy, which is take the data, make it, turn it into insights, turn the insights into actions, and learn from those actions, but do so that each stakeholder group that works together is able to clearly draw lines of delineations around data that that they feel is proprietary, all the while respecting the fact that consumers at the end of the day, own their own data, and that we've got to make it easy for them to manage the rights and the consents around that data. So that, in a nutshell, is kind of what we're doing with the Anthem platform strategy. Now, imagine in the health tech context, as more and more data gets piped into that platform, the platform itself is going to get more and more intelligent. And with more intelligence, we're going to be able to deliver more and more personalized experiences. And the more personalized the experience gets for every stakeholder that's using it, they're more likely to stick around and use it more and more, and thus, it creates a virtuous cycle, for all that are involved. Beyond that, Anthem alone cannot, address, all of the issues that we face in the healthcare industry. It requires a collaboration across, a local and a global ecosystem of, smart companies, startups, and academic institutions that all need to kind of come together to make this happen. So to facilitate that, Anthem has created several forums through which this collaboration can happen. And I'll give you a few examples. First, we created something called the Anthem Data Sandbox. And this data sandbox allows collaborators across the ecosystem to come together and use anonymized data and synthetic data that Anthem's created that simulates the conditions that we all face, and allows the broader stakeholders to create algorithms, insights, applications using our synthetic and anonymized data, and then test if it works. And if it does work, Anthem provides a distribution mechanism and a scaling mechanism, integration mechanism to take those solutions and make it available to all of our stakeholders. So that's one. Beyond that, we also have created a developer community that has access to all of the Anthem software development toolkits, the data sandbox, and the do's and don'ts of how to create applications in healthcare. We all know that healthcare is a highly regulated environment that is not for the faint of heart. So we've tried to simplify that regulated environment into something that developers can easily understand and learn how to navigate what to build using the Anthem tools, data, and the infrastructure that we're providing. So again, why are we doing that? And we firmly believe that Anthem alone, can't solve all of the issues that we face. So having the benefit of a global developer community helps us all. It's helped other other tech giants and other companies that have leveraged similar concepts. So it's about time that we deployed it for health and leverage the collective wisdom of the crowds to address some of the issues that we need to get solved in the very near future. We're also leveraging a global ecosystem. For example, we have an R&D center in Israel, and as some of you may know, Israel's got one of the world's most vibrant startup ecosystem, and we're working with many of the brightest and up-and-coming companies in Israel, getting them access to Anthem synthetic data sets and teaching them about the US healthcare system so they can train the algorithms on localized US data and build applications and solutions that are ready-made to work in the US environment. And then when it's ready, when the solutions are ready and when they've been proven, we can integrate them into our platform and then get them out to our collective integrated stakeholder group. So using this approach, the smartest people are working on the problems. We've got a global community of developers working on the issues to address healthcare, and we've got startups around the world that are leveraging the Anthem ecosystem and the Anthem platforms to create solutions for us. This solution, I think this approach, could be leveraged by others. And if all of us collectively adopt this mindset that we're in this together, and we can address the issues, through platform-based approaches and by creating ecosystems of collaboration based on trust, I do believe that the system of the future for all of us is going to be radically different. And what we're trying to get at ultimately is healthcare today is largely a reactive, retrospective system that kicks into gear when a person falls sick or an issue happens. And at that point, the system does work, and addresses the issue in that context and that illness and that sickness in that context. But what's lacking is, the things that need to happen before the event happens, and all the things that need to happen subsequent to it. For anything that's transactional and one and done, I think the system is relatively okay. But again, it's retrospective and reactive to something that's happened, an issue and an event that's happened, versus being able to do something preemptively. So what if we can create a healthcare system which in the future is able to predict what might happen before the event actually happens? Guess what? We've got hundreds of millions of data points that we could leverage to predict exactly that. So is a person likely to develop a chronic condition? Is a person likely to fall when they get home after a surgery? Is a person likely to develop an adverse reaction from a drug? Is a person likely to develop a behavioral health issue or a substance abuse problem? Any of these things, there's data and there's signals to be able to predict it. So if we're able to predict predict from these signals what might happen in the future, then why not preemptively address the issues and personalize the experience so that the consumers of healthcare that for whom we're predicting these futures, we're able to keep them on a proactively healthy health trajectory. And that's the future that's entirely possible. It's within our grasp. And guess what? We're already doing it today. So the question is, let's get ready. Let's work together to scale it. Thank you, and good luck.